Coming up on the next edition of For the Health of It with Tara Bush.
We had a case not too long ago from Grand Cayman, and that was the case. The person got the same identical chemotherapy. It was not being effective. They came over, the doctor reviewed it, tweaked it, got a little more aggressive with the dosage, and it started to work. So it wasn't like a misdiagnosis, it was just not aggressive enough for that particular cancer.
Radio Cayman, your community station, now presents For the Health of It with your host, Tara Bush.
Hello and welcome to For the Health of It. I will be conducting a telephone interview with Maria Freed, who is the developer or owner of Ornoa, a patient navigation service that assists patients coming to South Florida for medical reasons. The focus of the show will be on second opinions and the importance of them. Why is this important, Maria?
Well, it's good to be with you. The importance of second opinions through the many years of dealing with patients, specifically cancer patients, is the peace of mind that it brings. I've seen it both ways. I've seen patients who thought they were sicker than they really are, only to find out that independent review, the diagnosis was not correct. There's a much simpler solution and treatment plan. And I've seen quite the opposite. Folks who were perhaps thinking they're not as sick, but upon second review, find something a little more in-depth and something that requires more immediate and a more aggressive approach. So it can go either way.
Let's backtrack a little bit. What is Ornoa and what sort of services do you offer your patients?
Well, I started Ornoa, which is an independent patient navigation services, about 2 years ago. When I was a director of international services for the University of Miami School of Medicine, one of the challenges we had was providing good customer service. Not clinical care. The university offers excellent care, but all the challenges that travelers to South Florida face, anything from airfare and lodging and who will pick me up at the airport and how about if I get lost and will my insurance cover this? All of those nuances that are part of a medical visit, Ornoa takes care of for patients and their family members. So anything from air travel to hotel reservations, we pick people up at the airport, we offer ground transportation, we expedite medical appointments so you can see the physician quickly, or labs, or imaging, or a medical center. We make sure that your medical reports are done quickly in time for the doctor to review or perhaps for you to take back home with you. If you don't have insurance or you have undercoverage, we help negotiate good self-pay prices so that you're not paying a lot of money, you're paying fair prices, and we can do that because we have local knowledge of what things should be going for. We offer assistance with getting insurance authorization. We're not an insurance company, but we understand how they work, and many times people don't even understand the plan that they have. So one of the things we like to do is kind of introduce you to your case manager at your insurance company and kind of help you understand what is covered, what is not covered, and what is the process. One of the things that we do also is escort the patient to the medical visit so they're not alone.
Right, and that's important especially when you're facing a big illness like cancer or heart diseases, anything major to your health. You need an advocate, and sometimes a family member either can't come with you or they're just so caught up in what the news will mean to them.
It's true.
And the emotionality of it all that they're incapable of helping or assisting you in the way they should.
Our nerves kind of take over, and that's just, that's true for everyone. And so I think of all the things we do, that's the one one thing we get the most positive feedback from patient is that we get to be right there in the consult room with the patient, with the doctor. We take notes, and we ask a lot of questions because we think that if we don't understand it, then the patient isn't going to understand it. So it's a sort of a reinforcement of what's going on in that room. And, of course, before the patient comes, I always ask, get your questions ready. You know, what do you want to know? So that when we're there, we don't forget to ask them.
I heard you say that, you're kind of like the traffic cops of the medical industry, if you will. You help coordinate everything, or the concierge, I should say, of the medical industry.
It's true, and the U.S. healthcare system is very challenging, and it can be extremely inefficient at times. Rigid protocols. Maybe you had an MRI in Grand Cayman, and now you're here, and a month later somebody's asking for another one. Well, that's somewhat inefficient if there was, the MRI was perfectly well for the doctor to read back home. Why isn't it good enough here? And so those are the things we look for so that we don't run up costs, you don't get tested or not necessary. And to do that is just really do a little bit of research, make sure that all the medical records are gathered and are here by the time that the patient shows up so that the doctor is aware of what's already been done.
Right. And that's all very important when you're dealing with these big illnesses or major illnesses.
It is. There's a lot of duplicity and a lot of blood work and a lot of imaging, and sometimes not all of it is necessary.
Yeah, I just have recovered from surgery, and over a course of 3 days, and down here as well, because they did a lot of blood work on me, and I wish I had your service, but at the end of it, I got stuck 22 times before they could get a vein for me, and I have to tell you, I have never cried as much as I cried that day.
Aww.
But I'm recovered and I'm blessed.
I'm glad to hear that.
So when should a person get a second opinion?
Well, there's a lot of reasons for getting a second opinion. One of the main ones is you want to know that the treatment that your doctor has recommended is appropriate. I mean, you may have various options, and perhaps the doctor only discussed one option. It's good to know that there's several. You still may pick that original one because that's, the best one. You feel comfortable with that. But it's nice to know that there's various ways to approach an illness, and especially cancer, which is so individualized. There are no two identical cancers. And so it's a complex disease. There's no cookie-cutter way of treating it. It really is nice to know that there's more than one option. Or perhaps you've been told you need surgery first, and then you need chemotherapy. Well, sometimes it's the opposite. The sequence of treatment can vary, and it's nice to know that you have options in that. If you're an elderly person, perhaps surgery would be risky. Perhaps chemotherapy is called for, and surgery is left for as the last option.